Today is September 24th. I know that doesn't mean anything to you, but it does to me because I am an aHUS patient and survivor. September 24th is aHUS Awareness Day. Most of you watching probably have no idea what I'm talking about, which is why I'm making this video. aHUS stands for atypical hemolytic uremic syndrome and can be caused by things such as E. coli. Anyone can get it, but it's usually a one-time occurrence, and those who are affected get better and can proceed with their normal life. aHUS stands for atypical hemolytic uremic syndrome. The difference in aHUS and aHUS is all in the genetic code. Whereas aHUS is only a one-time illness, aHUS is an ultra-rare genetic disease that affects less than 1 in a million people and can happen multiple times. People who have aHUS have an extremely rare genetic mutation in their DNA, and each person with this disease has a different mutation. aHUS works differently from other diseases and can lie dormant until an outbreak occurs. When an outbreak happens, it causes their body to pop and destroy its own blood cells and clog the kidneys, and can also affect the body's other organs through the complement system, and because it is genetic, there is no cure at this time. Those living with this disease have to be very careful because there are many things that can trigger an outbreak, such as stress, trauma, another illness, surgery, pregnancy, and the list goes on and on. Until the 90s, the only treatment available for aHUS patients was dialysis, where they would have to spend almost every day in a hospital if they didn't want the chance of another outbreak, and even then it didn't always prevent it. The company Alexion produced the drug eculizumab, or Soliris, and discovered that it works much better on most patients than dialysis. Soliris isn't a pill that can be popped in a second or a medicine you can down while holding your nose. It has to be taken through infusions through a needle in a tube, and as of right now is the most expensive drug in the United States. Patients in certain countries don't receive this medicine because the drug is either unavailable in the country they live in, or it is too expensive, or they and their families decided a different route of treatment. In April of 2017, I had my first outbreak of aHUS and almost died. My platelet count, which should be over 200, was at 11, and I was in full kidney failure, and I received over 14 blood transfusions. But thanks to the doctors and nurses at Cook's Children's and Soliris, my story is one of triumph. After being diagnosed, my life hasn't been the same, and I know it never will be. There's a lot of things I can't do or have to be careful doing. I'm not supposed to share food, swim in lakes or rivers, and I'm told water parks are a big no-no. All because I could get sick again. And after finding out what was wrong with me, so many things from my childhood started to make sense, like how I always got sick or how I literally never run a fever. I'm telling you this because I want you to understand. I've noticed a severe lack of empathy or understanding between people with the disease and people who are well. I know that there is no possible way for you to actually understand what it's like to go through something like this, unless it's actually happened to you. I want you to hear me and see me. I'm not just someone saying things on the internet. My words hold truth. And I want there to be a connection, a face that can be added to my words so that maybe people will realize that real people are being affected. I want you to know that there's people like me who exist all around the world with their own story to tell. And not just people with aHUS, everyone who has a rare disease or illness, because so many of us can relate to one another. Today is a day of visibility for that small number of us to be heard and to hopefully spread education and awareness for atypical hemolytic uremic syndrome, or aHUS.